Welcome to the deep dive. Today, we're really getting into something fascinating, how surgeons manage to operate with incredible precision inside the human body, often without, directly touching anything. Think about it. The body is this super complex puzzle, and surgeons are navigating it through tiny little keyholes watching on screens. They're relying totally on these amazing tools,
Yeah.
these extensions of their own hands and skill. These are the unsung heroes we're calling cutting and dissecting instruments.
Yeah.
Yeah, it really does sound like science fiction, doesn't it? Performing these really intricate tasks deep inside someone, through incisions barely big enough for the tools, your hands are outside, you're watching a camera feed, and you can't really feel what you're doing in the same way. But this isn't the future, it's happening right now. It's the reality of laparoscopic surgery. It's where, engineering brilliance really meets the complexities of biology.
It really is. And the tools, the instruments designed for this kind of environment, they're honestly nothing short of remarkable. Today, we're going to do a deep dive into these cutting and dissecting instruments. They are essentially the scalpels and scissors of keyholes surgery, but they've been completely reimagined, re-engineered. They're hyper-specialized. You'll see they're vastly more advanced than the traditional tools you might picture. They're meticulously crafted to overcome the unique challenges of operating almost remotely, turning these huge constraints into incredible precision.
Okay, so our mission today is to really unpack the genius that's engineered into, well, every curve, every single tip, even the energy pulses of these tools. We'll look at the unique design ideas behind them, explore the main categories from the sort of mechanical workhorses to the really advanced energy devices. And crucially, we need to talk about why safety is just absolutely paramount when you're using tools this powerful. By the end, you'll really appreciate the sheer precision and innovation in modern surgery and understand how these specialized devices lead to better outcomes, faster recoveries, and way less trauma for you, the patient. Right. Let's start there. We often hear keyhole surgery or laparoscopy talked about as just being less invasive, smaller scars. But for people who really follow this stuff, the true magic and the real challenge isn't just the small cut. It's how surgeons make up for losing that direct touch, that three-dimensional feel. Can you paint a clearer picture for us? How fundamentally different is this from traditional open surgery, beyond just the size of the incision?
Absolutely. It's a complete paradigm shift, a total change in how surgery is done and even perceived. It's a leap from, direct multisensory interaction to something mediated almost entirely visual. In traditional open surgery, a surgeon has their hands right there, direct access. They have a wide three-dimensional view and critically full tactile feedback. They can feel the texture of tissues, the tension, the subtle differences between layers as they dissect. They can even use their fingers for what we call blunt dissection, gently pushing tissues apart. Or they can use larger instruments and get immediate, really nuanced haptic feedback.
Okay, so it's very hands-on, literally.
Exactly. Now, in laparoscopy, almost all of that is gone. You're working through these tiny rigid entry points, the ports. Your view is completely dependent on a camera shown on a 2D screen. And your instruments, they're long, thin rods that transmit, frankly, very little of that vital tactile sensation back to your hands. Your hands are out here, but the work is happening deep inside. It might be magnified, yes, but you lose that intuitive depth perception, that subtle biological language you get through touch. So it demands a completely different approach to the tooling. The instrument itself has to become this incredibly intelligent extension of the surgeon, making up for that lost sensory input and allowing for precise, controlled movements in what's often a very confined, sometimes visually disorienting space.
Wow, that really does highlight the shift. It's almost like you're trying to navigate this incredibly sensitive, complex ecosystem, but you're doing it from a submersible way above, looking through a camera, using robotic arms. It makes me wonder, from an engineering standpoint, what was the single biggest hurdle? Trying to translate that very tactile 3D skill of a surgeon into just a 2D visual field and these long, kind of unwieldy instruments. Was it precision, control, something else?
That's a really good question. And honestly, it wasn't just one hurdle. It was more like a whole constellation of challenges they had to solve simultaneously. But if I had to pick the most significant, Ferris, it was probably the translation of proprioception and haptics. In open surgery, your brain just knows where your hands are in space instinctively, and your fingers are constantly telling you about tissue density, tension, texture, all that stuff. In laparoscopy, the instruments create this fulcrum effect at the incision point, which actually reverses your hand movements at the tip inside. Plus, the sheer length of the instrument shaft dampens almost all the subtle tactile feedback. So engineers had to design instruments that could give visual cues to make up for that lost touch. They had to allow for incredibly fine motor control, even with awkward angles. And often they had to integrate multiple functions into one tool because every time you swap instruments, it adds complexity and time. It was really about creating tools that could be seen to perform with the kind of precision that traditionally you needed to feel.
Right, seen precision replacing felt precision. Okay.
Yeah.
So, given these huge constraints, no direct touch, the 2D view, this amplified distance, what are these instruments actually designed to do? What are their fundamental jobs in this unique surgical world?
Exactly. Given those constraints, these cutting and dissecting instruments, they have to be designed for just maximum precision, minimum tissue trauma, and really reliable control. Their purpose generally falls into three fundamental roles. Each one is critical for navigating inside the body safely and effectively. First, they are used for, well, cutting tissues. And this includes incredibly delicate structures that need extreme finesse. Think about adhesions, those abnormal bands of scar tissue. They can form after previous surgery or inflammation, sometimes sticking organs together where they shouldn't be. Or maybe the peritoneum, that really thin, slippery membrane lining the abdomen. Cutting that requires a very precise, clean incision. These are often sort of filmy, fragile things, and the instruments have to let surgeons divide them without accidentally damaging vital organs nearby. Before these specialized tools, surgeons often had to painstakingly tease adhesions apart. It was slow and, frankly, carried a higher risk of tearing something.
I can see how precision there is absolutely key, especially with adhesions. It's not just making a cut, but making exactly the right cut in a really delicate spot.
Precisely. The second role is separating tissue planes. This is vital for exposing anatomy safely. Imagine you need to gently part layers of muscle or fat or connective tissue. Maybe you're trying to trace the path of a ureter or reveal a blood vessel that's hidden, or a critical nerve, or get a clear view of an organ without damaging anything around it. It's almost like a careful surgical archaeological dig, gently uncovering the important structures underneath. This kind of delicate separation often needs a mix of blunt dissection pushing and sharp dissection cutting. So you need tools that can do both, sometimes at the same time, with absolute control. It's about creating a safe space to work and making sure the surgeon clearly understands the anatomy they're seeing.
A surgical dig, I like that analogy.
And finally, a really key differentiator, and arguably one of the most advanced functions, is dividing vessels or ducts with simultaneous hemostasis. Hemostasis just means stopping bleeding. So this isn't just about cutting a blood vessel or maybe a bile duct. It's about cutting it and stopping any bleeding or sealing the duct at the exact same moment. This is absolutely essential. You need to maintain a clear surgical field, prevent significant blood loss, and ensure patient safety. Without this capability, every single cut would need a separate step just to manage the bleeding. That would drastically increase the time surgery takes, mean more instrument changes, and significantly raise the risk of complications for you, the patient. It's truly a testament to the ingenuity in these tools that they can manage such a complex dual action.
That last point, the simultaneous hemostasis, that sounds incredibly important. You're not just cutting, you're managing the consequences right away, almost in the same movement. It really does sound like this finely choreographed dance between precision and control. Every move has to be deliberate, efficient, proactive. It shows how these tools are really sophisticated extensions of what the surgeon intends to do, performing complex, multi-step actions in just one fluid, controlled way. It's definitely more than just cutting. It's like intelligent tissue management. Okay, let's dive into the toolkit itself, starting with what might seem the most basic. Scissors. We all know scissors, but what makes laparoscopic scissors so special, so adapted for working inside the body through those tiny ports?
Right, they seem basic, but they're fundamental and incredibly versatile tools in the laparoscopic arsenal. But they are absolutely tailored for the unique demands of internal surgery. They come in specialized forms, each really designed to handle the nuances of different tissues and different anatomical spots. For instance, you have Metzenbaum scissors. These are known for their slim, often curved blades. They are specifically ideal for what we call fine tissue cutting. Think about those delicate membranes or the thin adhesions we just talked about, where absolute precision is paramount. That slim profile isn't just for looks. It's carefully engineered to navigate tight spaces. Imagine clearing adhesions around the bowel. Even a millimeter of extra bulk on the instrument could block the view or accidentally nick something delicate. And the curve. That often helps navigate around structures. It lets the surgeon follow the natural contour of an organ or a vessel while making a precise cut, minimizing the risk of hitting something critical by accident. It's all about achieving that surgical choreography in a very confined space.
So that curve isn't just a design choice, it's functional, helping maneuver better and dissect more safely when everything's packed tightly together. What about other types of specialized scissors?
Exactly. Then there are hook scissors. Like the name suggests, they have this distinct hooked tip. This design is great for precision snipping in narrow areas. The hook serves a really crucial purpose. It lets the surgeon lift or isolate a tiny piece of tissue, maybe a really stubborn strand of adhesion, before they make the cut. This action helps prevent accidental damage to healthy structures right next door by creating the small, controlled pocket for the cut. It's about making a secure, isolated target so the surgeon can be absolutely sure about what they're dividing. That's critical when you don't have that direct tactile feedback.
Isolating the target first. Makes sense.
And then for more general tasks, but still remarkably adaptable, you have endoscissors. These are kind of your general-purpose workhorses. They have long shafts, they're robust, and crucially, they often feature a rotatable tip. The ability to rotate the blades, 360 degrees or at least a significant amount, without having to rotate the entire instrument shaft. That is a complete game changer. Imagine your hands are fixed outside the patient, going through a port at a certain angle, but you need to change the angle of your cut inside. A rotatable tip lets you make that adjustment on the fly. It massively improves the surgeon's dexterity and precision without them needing to shift their whole body or change the instrument's entry point, which would just be clumsy and waste time.
Yeah, that rotatable feature sounds absolutely essential when you can't just twist your wrist inside the patient like you normally would. It adds a whole new dimension of control to that 2D view. And you mentioned many of these scissors are also monopolar compatible, allowing simultaneous cutting and coagulation. Can you quickly demystify that for us? Because it sounds super efficient, that two-in-one function. But I bet it brings in a whole new layer of safety stuff, too.
You're absolutely right to pick up on that. Essentially, it means electricity can be passed through one of the scissor blades. When the surgeon activates this, usually with a foot pedal or maybe a button on the handle, the electrical current effectively cuts the tissue. But at the same time, the heat generated by that current cauterizes or seals the tiny blood vessels right in the cut area. This process coagulates them, stopping bleeding immediately. It's a hugely beneficial two-in-one function. It drastically improves efficiency, no need for a separate tool or step to stop bleeders, and critically, it reduces blood loss. That keeps the surgical field clear so the surgeon can see what they're doing. Now, safety-wise, it demands absolute precision and a very clear understanding of how that electrical energy works. Surgeons have to be really mindful of potential stray energy or maybe direct coupling where the energy jumps to another metal instrument, which could cause unintended burns. So while it's incredibly efficient, using it requires meticulous technique and just constant vigilance.
That's incredibly efficient cutting and stopping bleeding all at once. Much cleaner, faster. But for our listeners, does that mean there are trade-offs? Integrating electricity into a mechanical tool like scissors? Or are there times a surgeon might still go for a purely mechanical cut, then deal with bleeding separately?
That's a crucial distinction, yeah. While these monopolar compatible scissors are incredibly versatile, there are definitely trade-offs sometimes. The heat generated during coagulation, the cautery, can occasionally cause a slightly wider area of thermal spread heat damage than a purely mechanical cut. That might be undesirable in extremely delicate areas, or maybe right next to critical structures like nerves where you want zero heat effect. Also, tissue cut with cautery can sometimes be a bit more friable, or maybe the edges aren't quite as clean as with the purely sharp mechanical cut. So in situations demanding absolutely pristine tissue planes or where any thermal damage has to be strictly avoided, maybe dissecting around a nerve bundle, a surgeon might indeed choose to make a very precise mechanical cut first. Then they'd manage the hemostasis, the bleeding, separately, maybe with a bipolar instrument which confines the energy much more locally. It always comes down to picking the right tool for that specific tissue and the specific anatomical context.
Right, so it's always about matching the tool and the energy type to the exact job at hand. Okay, beyond cutting, you mentioned the vital need to separate and manipulate tissues, sometimes without cutting them at all. This is where dissectors come in. And they often combine those fine jaws with pointed tips, allowing both blunt and sharp dissection, really embodying that delicate dance you talked about, careful exploration before precise action.
Exactly. That dual capability makes them incredibly useful, really central to many laparoscopic procedures. Let's look at a few key types that are the real workhorses for this kind of meticulous separation. First, the Maryland dissector. This is arguably the most commonly used laparoscopic instrument, period. Its versatility is amazing. It comes from its fine, often slightly curved jaws that can do so much. They can grasp tissue firmly but gently. They can dissect both bluntly by just separating layers and sharply with very fine cutting at the tip. And they can even coagulate using monopolar energy if they're compatible. It's genuinely like the Swiss Army knife, the multi-tool of laparoscopic instruments. It's indispensable for almost any task that needs careful tissue handling. Think about a surgeon doing, say, an appendectomy.
It might use the Maryland to gently separate the appendix from the fatty tissue around it, carefully teasing apart those delicate tissue planes. Then, maybe with a flick of a switch, the very same instrument can seal off tiny little bleeders, keeping the view clear, or can even perform a precise, sharp dissection of a small adhesion.
Its slightly curved tip is especially good at following natural anatomical curves, allowing for really meticulous work in areas where a straight instrument might just be clumsy or even dangerous. Its adaptability is its greatest strength. It's often the first instrument a surgeon will reach for.
So if you had to pick just one instrument a lab surgeon uses most often, it sounds like the Maryland would be it. Incredibly adaptable, almost like the surgeon's surrogate finger and thumb inside the body.
Precisely. That's a great way to put it. Then we have the right angle dissector. This instrument has a very distinct right angle bend right at its tip. It's ideal for encircling vessels or ducts. End the quote. It's particularly useful in procedures like cholecystectomy gallbladder removal, where surgeons need to meticulously isolate and secure structures like the cystic duct or the cystic artery before they divide them. The sharp angled tip lets the surgeon carefully hook around a vessel or duct, making sure it's completely free from all the surrounding tissue before they put a clip on it or cut it. This critical step prevents accidental injury to other vital structures nearby. It offers that moment of visual confirmation, making sure everything is clear before they commit to dividing it.
That right angle design must be incredibly helpful for getting behind things that are really tightly packed together, providing that crucial visual check that might be missing because you don't have the direct feel. It's a real testament to how specific anatomical challenges drive these ingenious instrument designs.
Absolutely. It's all about solving specific problems. And finally, there's the hook dissector. It's similar in concept to the hook scissors we talked about, but it's designed mainly for blunt work. It specializes in lifting and separating structures. This can be crucial for just creating a safe space or identifying an anatomical plane without actually making an incision yet. By gently lifting and pushing tissue, the surgeon can visually confirm what they're dealing with and create a clearer path for whatever comes next, all while minimizing trauma. It's really a tool for careful exploration and for creating just the right amount of tension to safely expose the anatomy underneath. Again, it's compensating for that lack of direct tactile feedback by enhancing the visual information.
So these aren't just for cutting, they're really about careful exploration and preparation too. The hook dissector especially sounds like it's designed for that delicate navigation around critical bits anatomy, giving that vital visual confirmation. It really underlines how important it is to see and understand the anatomy thoroughly, almost like a sculptor carefully revealing the form hidden inside the stone.
That's an excellent analogy, yes. And speaking of manipulating tissues with precision, that brings us nicely to instruments specifically designed to leverage the power of electrosurgery. We talked about how monopolar energy can be integrated into tools like scissors, but there are whole classes of instruments designed specifically around delivering this energy, particularly hooks and spatulas. These give surgeons incredible control over both tissue division and stopping bleeding, the hemostasis. Take the monopolar hook. This instrument has a sharp, angled tip, often L-shaped. It is excellent for dividing peritoneum and adhesions. Its shape lets the surgeon hook onto a thin layer of tissue, apply the electrosurgical energy, and then cut and coagulate at the same time. The sharp hook can engage and lift the tissue slightly, making it easier to apply the energy in a really controlled way, ensuring the cut is exactly where it needs to be. Meanwhile, the energy instantly seals any small blood vessels, keeping the field nice and dry. This targeted application significantly cuts down on operative time and blood loss for you, the patient.
It's like a tiny electrified grappling hook designed just for those fine tissues, letting them do incredibly precise and clean dissection without ever needing to swap out the instrument. That must speed things up a lot.
Exactly. Speed and efficiency are key. And then there's the spatula dissector. This one features a flat tip, like a tiny spatula. It's incredibly versatile because it can push, spread, and coagulate tissue planes. The flat, broad surface allows for gentle, broad manipulation of tissues. For example, carefully pushing an organ aside or spreading layers apart to expose something deeper. While doing these actions, the surgeon can simultaneously apply electrosurgical energy either for very fine dissection along the edge or for achieving hemostasis over a broader surface area. This makes it a very adaptable tool, good for both careful manipulation and controlled energy application. It offers this broad interface for interacting with tissue while still giving you all the benefits of electrosurgery.
It's fascinating how just the shape of the tip completely dictates its main use, even when the energy behind it is the same. It really is all about adapting to the specific tissue and the specific task at hand, making sure you're using the most efficient and safest approach. These mechanical and electrosurgical instruments sound like the fundamental workhorses, truly, allowing surgeons to navigate and manipulate inside the body with remarkable precision. But modern laparoscopy doesn't stop there, right? The drive for even less trauma, even faster recovery, has led to a whole new generation of tools. While those mechanical and basic electrosurgical instruments are fundamental, yeah, modern laparoscopy has pushed the boundaries way further with advanced energy devices. These are really the cutting edge, aren't they? Representing a huge leap forward in how surgeons tackle tissue division and hemostasis, moving beyond simple blades and basic electrical currents.
Absolutely. These devices are a significant leap. They offer capabilities that go way beyond traditional cutting and coagulation with simple monopolar or bipolar electrosurgery. They provide these highly precise energy delivery mechanisms to simultaneously divide tissue and securely seal it, minimizing bleeding and dramatically improving surgical efficiency. Often, they actually replace the need for sutures or clips in many situations, which streamlines the whole surgical process and also reduces the amount of foreign material left inside the patient's body. The engineering behind these devices is truly pushing the limits of what's possible in surgical care.
Okay, so what are some of these really sophisticated tools that our listener might encounter if they were, a fly on the wall in a modern operating room during a lap procedure? What makes them so revolutionary in how they interact with our tissues?
Well, first, we have the Harmonic Scalpel. This device uses ultrasonic vibration, incredibly rapid, high-frequency mechanical energy to simultaneously cut and coagulate tissue. Just imagine a blade vibrating tens of thousands of times per second. We're talking frequencies up to 55,500 hertz, which is way beyond human hearing. This kinetic energy gets transferred directly to the tissue. It causes the cells themselves to vibrate intensely and essentially break apart, which is the cutting action. At the same time, the localized heat generated by this friction, along with the denaturing of proteins in the tissue, achieves the sealing, the coagulation.
Ultrasonic vibration. So it's not heat in the traditional way, like with an electric cautery. It's more like friction and mechanical energy doing the work. It sounds like they've managed to harness sound waves almost to get this surgical precision, maybe like a laser, but with less heat damage around it.
Precisely. That's a great way to think about it. The rapid vibration generates localized heat, yes. But crucially, it also denatures the proteins within the tissue. Think about cooking an egg. The proteins change their structure, they solidify. This coagulation effectively seals blood vessels and also lymphatic channels, up to about 5 millimeters in diameter. Simultaneously, the sheer mechanical force of the vibration precisely divides the tissue. It's this dual action happening right at the cellular level that makes it so unique. And critically, it minimizes thermal spread compared to devices relying purely on electrical current passing through tissue. Now, why does that matter to you, the patient? Less thermal spread often means less post-operative pain, reduced inflammation, and quicker healing, simply because the healthy tissues right next door are spared from unnecessary heat damage. Before the harmonic scalpel, surgeons often faced a choice: make a clean cut that might bleed more, or use electrocautery, which stopped bleeding but could cause significant collateral heat damage. The genius of ultrasonic vibration was that it offered this third way, almost like a cold cut that also seals. It was a breakthrough that fundamentally changed how we think about tissue interaction and radically improved patient recovery.
Wow, that is a huge advancement, reducing that collateral damage for a faster, more comfortable recovery. Does that mean it also handles different kinds of tissue better than traditional electrosurgery? Or are there still specific tissues where a surgeon might prefer an electrical current?
That's an insightful question. The harmonic scalpel is particularly excellent for delicate, thin tissues. And it shines in areas where any collateral thermal damage is a major concern, like operating near nerves or close to the bowel wall. However, for very dense fibrous tissues, or maybe for extremely thick-walled blood vessels, a surgeon might still opt for a more traditional electrosurgical device, or perhaps even a surgical stapler, which can offer a more robust mechanical closure or seal in those specific situations. It's always about choosing the optimal energy platform for the specific tissue's characteristics and, of course, the surgical goal.
Okay, matching the energy to the tissue. Makes sense. What's next in the advanced energy lineup?
Next, we move to the ligature. This is an advanced bipolar device that really takes vessel sealing to a new level. Unlike traditional, simpler bipolar devices, it uses this sophisticated combination of pressure applied by the instrument's jaws and precisely controlled electrical energy. Crucially, it also incorporates a real-time feedback system. This system constantly monitors the tissue's resistance to the electrical current, and it adjusts the energy output accordingly. This allows it to create a very strong permanent seal by effectively fusing the vessel walls together.
Bipolar, right? Meaning the electrical current flows just between the two electrodes on the instrument itself, not through the patient to a grounding pad, which makes it even safer and more localized.
Exactly. The energy is very localized, highly controlled, and inherently safer because it's contained within the jaws of the instrument. What's truly remarkable about ligature, though, is its ability to reliably seal vessels up to 7 millimeters in diameter while cutting. Some models integrate a cutting blade that deploys after the seal is complete. This is a really significant advance. Sealing larger vessels using traditional methods can be much more challenging and time-consuming. It often requires placing multiple clips or sutures, which not only takes time but also leaves foreign material inside the body. Ligature creates this permanent secure seal. It literally fuses the vessel walls. This drastically reduces the risk of bleeding after the operation and improves the long-term integrity of the surgical site. That feedback system is key. It ensures only the precise amount of energy needed for an optimal seal is delivered, then it stops automatically. That's a level of control that was unparalleled in earlier technologies.
Sealing vessels that large, that securely, all in one go. That really does sound like a game changer for a lot of procedures. It must seriously cut down on operating time and boost patient safety, especially since controlling bleeding is so critical in any surgery.
It absolutely does. The reliability of the ligature seal has been shown to be comparable to using sutures or clips for many vessel sizes. This has revolutionized procedures where managing large vessels quickly and securely is paramount to think about things like spleen removal or certain types of bariatric surgery or complex cancer operations. It significantly contributes to a faster, safer, and ultimately more efficient surgical experience, both for the surgeon and, most importantly, for you, the patient.
Amazing. So we've got ultrasonic and advanced bipolar. Is there anything that combines these?
Funny you should ask. Finally, for the really advanced and complex procedures, we have the Thunderbeat. This is a hybrid device combining ultrasonic cutting with bipolar sealing. It essentially merges the best features of both the Harmonic Scalpel and the ligature into a single, highly versatile instrument. It gives the surgeon an unprecedented array of options right at their fingertips.
So it's basically the best of both worlds. You get the precise, minimal thermal spread cutting from the ultrasonic vibration and the robust, secure sealing capability from the advanced bipolar energy, all in one tool. That sounds like a surgical powerhouse. But when you pack so much capability into one single instrument, does that create its own unique challenges for the surgeon? Is there maybe a risk of, say, over-reliance on one tool, or maybe a steeper learning curve to really master such a versatile hybrid device?
That's an excellent point, and yeah, you've hit on a core aspect of surgical innovation. While the Thunderbeat offers just unparalleled efficiency and versatility, mastering it definitely requires a sophisticated understanding of both energy modalities. And crucially, knowing exactly when to apply each one. It's not just about pushing a button, it's about having that intuitive sense of when to engage the ultrasonic for really precise, delicate dissection, versus when to lean on the bipolar energy for robust sealing of larger vessels. And sometimes even how to use them synergistically. This combination offers unparalleled speed and versatility in advanced procedures. It allows surgeons to rapidly and safely manage a huge range of tissues and vessels, from the most delicate peritoneum right up to larger vascular structures, often with just that single tool. It's designed for maximum efficiency and really broad application within complex surgeries, where you encounter different types of tissue that need different energy approaches. The surgeon can switch between ultrasonic cutting and bipolar sealing, or even use them simultaneously in some modes without ever changing instruments. That significantly streamlines the operation. But as you hinted, the learning curve involves developing that really nuanced judgment and the dexterity to orchestrate all that power effectively and safely. It speaks volumes about the surgeon's constant need for meticulous training and split-second decision-making, even when they have the most advanced technology in their hands. It's never just the tool. It's always the highly trained mind guiding it.
It's truly incredible how these instruments have evolved, offering such specific yet incredibly powerful capabilities. It really is like going from a simple knife to this highly specialized multifunction tool, making surgery safer, more effective for you, the patient, by minimizing trauma, cutting down blood loss, and speeding up recovery. The innovation is just astounding, constantly pushing the limits of what minimally invasive surgery can achieve. Okay, so we have these incredibly powerful, precise, complex instruments. Safety, then, has to be just the absolute top priority, right? Even the most advanced tool is only as good as the hands guiding it and the critical thinking behind its use. What are the paramount safety considerations, especially when that direct tactile feedback is so limited?
Absolutely. Technology advances at this breathtaking pace.
But fundamental surgical principles, vigilant technique, they remain just as essential, maybe even more so, actually. The inherent challenges of laparoscopic surgery, that limited field of view, the loss of tactile feedback, the magnified 2D image on a screen, they all mean surgeons have to be even more meticulous in their approach. There are absolutely critical safety considerations when using any cutting and dissecting instrument, whether it's basic scissors or an advanced energy device, to ensure patient well-being and prevent complications. One of the most fundamental, a true golden rule in surgery, whether it's open or laparoscopic, is to always confirm anatomical planes before dividing tissue. Always. Before making any cut, the surgeon must be absolutely certain, 100% certain of the identity of the tissue they're about to cut, and crucially, what lies just beneath it or right next to it. Misidentification can lead to, well, devastating accidental injury to vital structures, major blood vessels, nerves, critical organs like the bowel or ureter. This often involves careful, blunt dissection first, retracting surrounding tissues, getting visual confirmation from multiple angles. Sometimes they even use intraoperative ultrasound or maybe cholangiography if they're near the bile ducts, just to be sure, before a sharp instrument is even considered, let alone activated. It's a really disciplined, systematic verification process.
So it really boils down to pausing, analyzing, double-checking, maybe even triple-checking before committing to that cut. Especially when visual cues are your main guide and you don't have that sense of touch. It really speaks to the surgeon's constant critical thinking, even under pressure.
Exactly. The human body is full of variations, anatomical differences. What looks perfectly clear on a screen might be obscuring a critical structure just millimeters away. Another key principle related to this is to prefer blunt dissection in critical areas to avoid accidental injury. When operating near nerves, major blood vessels, or really delicate organs, a surgeon will almost always opt for blunt dissection first. That means gently pushing and separating tissues using a blunt instrument like the Maryland dissection we talked about, or maybe even just the tip of a suction irrigator tool rather than going straight in with sharp cutting. This technique lets them create a plane of dissection by simply parting tissues along their natural anatomical lines, often separating connective tissue without actually disrupting the vital structures themselves. This significantly reduces the risk of inadvertently severing something important that might be just out of view or perhaps tightly stuck to what they're working on. It's definitely a slower, more deliberate process, but it is exponentially safer for the patient when you're in those high-risk zones.
That makes perfect sense. It's like carefully clearing away archaeological dust and debris with a brush, rather than just digging aggressively with a spade, when you know there might be something priceless and irreplaceable hidden right underneath. It really emphasizes patience and precision over speed in those critical moments.
Indeed. And here's one that might seem simple, but it's vitally important, perhaps surprisingly critical even with all this high-tech gear. Replace dull scissors promptly. Blunt blades increase the risk of tearing and bleeding. It sounds obvious, right? But a dull instrument is genuinely dangerous in this precise environment. Instead of making a clean, crisp cut, dull scissors can actually tear the tissue. That causes more trauma, it increases bleeding, and it makes the whole dissection more difficult and less precise for you, the patient. You know, I've actually heard senior surgeons joke that using a dull scissor in laparoscopy is like trying to cut a tough steak with a butter knife. Not only does it not work well, but you risk tearing the whole thing apart. A clean, sharp cut allows for better healing, less postoperative pain, and just more predictable tissue response. Surgeons are meticulously trained to recognize the signs of a dull instrument. Maybe it's snagging or not cutting cleanly and request a replacement immediately. Because that seemingly small detail, it has a massive impact on the quality and safety of the surgery.
So even with all the advanced technology, all the energy devices, the fundamentals like having a sharp blade for a clean cut remain absolutely paramount. It's a good reminder that you can't overlook the basics, even when the tools get incredibly sophisticated.
Absolutely. And finally, particularly when we're talking about those advanced energy devices, it's critical to limit activation time to reduce lateral thermal injury. Even with devices specifically designed for minimal thermal spread, like the Harmonic Scalpel or the ligature, excessive or prolonged activation can still cause unintended heat damage to the adjacent tissues. That heat can creep outwards, extending beyond the area you actually intended to treat. Surgeons are meticulously trained to use these powerful devices for the absolute shortest effective duration required to achieve the cut or the seal they need. This precise control, this discipline, protects the surrounding healthy tissue from unnecessary thermal damage. And again, that contributes directly to less postoperative pain for you, reduced inflammation, and faster, more complication-free healing. It's really a constant balance of wielding power effectively, but also with restraint.
It truly underscores that incredible precision isn't just about the tool itself, is it? It's about the surgeon's continuous critical thinking, their meticulous technique, and their strict adherence to these best practices. It's a real testament to the comprehensive, incredibly careful nature of modern surgical practice. Every detail, from how sharp the blade is to exactly how long they activate an energy device, is carefully managed to ensure the best possible outcome for the patient. It's a high-stakes dance, really, between technology and human expertise. Wow. What an incredible deep dive we've had into this world of laparoscopic cutting and dissecting instruments. From the foundational precision of things like Metzenbaum scissors and the sheer versatility of the Maryland dissector to the targeted power you get with monopolar hooks and spatulas, and then onto those groundbreaking advanced energy devices, the ultrasonic harmonic scalpel, the advanced bipolar ligature, and that hybrid powerhouse, the Thunderbeat. We've really seen how each tool plays such a critical, specialized role in making minimally invasive surgery possible and effective.
We really have. We've explored how these instruments truly represent the cutting edge of laparoscopy. They enable surgeons to perform procedures with a level of precision and minimal invasiveness that was unimaginable not that long ago. And this directly benefits you, the patient, through faster recovery times, significantly less pain after surgery, and much, much less physical trauma compared to traditional open operations. The relentless innovation we see in these tools is genuinely transforming healthcare, making procedures that were once really daunting much more routine and significantly safer.
And as we wrap up, here's something to think about. A provocative thought, perhaps. How do these kinds of micro-level innovations in surgical tools, tools designed for these incredibly precise tasks deep inside the human body, how might they set a precedent for technological advancements in completely different fields? Could similar leaps in precision tooling and miniaturization and remote manipulation conquering limitations like the lack of direct touch or dealing with 2D views, could that revolutionize areas like, say, microrobotics for industry, or advanced manufacturing of really delicate components, or maybe even deep sea exploration or space exploration, allowing us to interact with complex, challenging environments with unparalleled delicacy and control, much like surgeons now do inside us?
Thank you for joining us on this exploration of surgical innovation. We certainly hope you've gained a clearer understanding of the incredible technology behind modern minimally invasive surgery and maybe a new appreciation for the meticulous care and the sheer engineering genius that goes into every single design decision.
Stay curious, and we'll catch you on the next deep dive.